My name's Cheryl Crisp. I'm chairing today's meeting, and I warmly welcome all our participants and our speakers. We do have a very impressive lineup today, and I will outline our speakers a little bit later. But in opening today's meeting, I do want to draw attention to the October 1st UK school strike, which has just concluded. This strike, which was initiated by a UK parent, Lisa Diaz, who is the mother of 2 school-aged children, and her and millions of others are being forced to send their children into schools, into face-to-face learning by the Johnson Tory government. And all these children are as yet unvaccinated because there are no vaccines available for under 12-year-olds. There are also no protection of any kind, and there is no measures enacted by either the Education Department or the government to ensure that British children do not catch the virus. This has been done against all warnings by epidemiologists, doctors, scientists, teachers, parents, and in fact, children themselves, that the schools were not only not safe, but are in fact vectors for the spread of the virus. These warnings were summarily and arrogantly dismissed by the government. Johnson and all his acolytes have declared that all UK kids must return to face-to-face learning, and have actually deemed it illegal for their parents to not send them under threat of prosecution and fines. Masks are banned, social distancing is impossible, and ventilation non-existent. Teachers themselves face the danger of being infected, and even those who are vaccinated are left to defend and protect their little charges, not just from a virus, but from the government, whose policies open them up to it. The warnings that this policy would lead to mass infections and deaths has been borne out. Within 2 weeks, 59,000 UK children were infected and 88 dead. This was the price paid for the policy of herd immunity, most associated with the Johnson government, but not just the province of that government. In the United States, the Democrat President Biden is continuing the policy of his Republican predecessor, Trump, and has forced the reopening of schools, leading to more than 200,000 infections every week for the past 5 weeks. Now, this school strike is significant in that it represents the interests of society as a whole. It is also significant because it is being organised entirely outside the role of the unions, who have overseen and implemented the policies of governments. And most significantly, it is an international movement. The response, and I don't have reports yet of the widespread nature of the strike, but certainly on the World Socialist website, we have posted international greetings of solidarity from literally every continent. For us, for the situation in Australia, the conception that this country was exempt from this experience, I think the past 4 months must dispel that misconception. 4 months ago, there were no community transmission in New South Wales or in Victoria for that matter. Today, there are more than 56,000 cases of infections that have been recorded in New South Wales, and in Victoria, over 16,500. Hospitals in both states are crippled. Patients are left in the back of ambulances for hours and hours because there are not enough beds to admit them. 3 times as many people are under hospital in the Homes program in New South Wales than those that are actually in hospital. And that's the reason that so many people are dying at home. If the 3,850 who are in the hospital in the home program were actually in hospitals, the entire health system would crumble. In October, there were where the just resigned Premier Berejiklian stated we would see the highest influx of COVID patients. It would reach a code black. And what that means is that at which point health staff would have to make decisions that there are patients who would not be provided with life-saving treatment. As it has been outlined, some of those patients would have had an 80% chance of survival if provided with care. Yet the mantra is no more lockdowns, open up the economy, live with the virus. Would anyone, including those who oppose the vaccination and its mandatory nature, stand up in the streets of Melbourne or Sydney and declare that we would have to live with polio, we have to live with cholera or the Black Plague? No, because medicine, science, and society have established that not only can they be eradicated, but that they had to be. But we now have an open letter from the Business Council of Australia, representing the largest corporations in this country, demanding that we do just that, live with the virus. Why? Because they demand the end of lockdowns and the re-establishment of production and commerce. Morrison has just announced that in a month, all international borders will open. This is in direct response to the demands of the Business Council of Australia, of Qantas, and of corporate interests in this country. So when the pandemic began in, well, certainly in January of 2020, but where the first infections were recorded at the end of February and March in 2020 in this country. But internationally, millions of people thought that by the end of 2020, the pandemic would be over. But in fact, it has gone on and on, with deaths and infections rising. In fact, more people have been infected in the 9 months of 2021 than in the entire year of 2020. In fact, twice as many people have been infected in 2021. The same situation exists with deaths. Up until January, the 31st of December 2020, 1.95 million people had died. By the 1st of October 2021, more than 4.8 million have died. So 70% more have died in 2021 than 2020. Now, the International Committee of the Fourth International, of which the SEP in Australia is its Australian section, raised in March of 2020 that the pandemic was comparable to that of the assassination of the Archduke Ferdinand, which led to the outbreak of World War I, that the pandemic is a trigger event. Then too, in 1914, when soldiers, the young men of the world, marched off to war, they thought it would be over for Christmas. But instead, it went on and on and on, with the death toll rising to unimaginable levels. It was only through the intervention of the working class against the war in an international movement against war, most graphically and consciously expressed in the Russian Revolution in 1917, which brought an end to World War I. Otherwise, it would have gone on for years longer, irrespective of the death rate. And so it is that intervention, the intervention of the working class, that we fight for in this period, in 2021, because the working class must take matters into its own hands. It must take its fate, its future, out of the hands of the capitalist class that has proven it will easily trade the lives of millions of people for that of trillions of dollars. They've had their chance. They have proven to not only be incapable, but uninterested in pursuing any measures to stop the virus that will impact on profits and production. It is time now for the working class to act. And that's the reason that we're holding this discussion and why we encourage as many questions and comments as you feel fit. As I said, we have 3 speakers today who I'm very, very proud to introduce. Our first speaker will be Julia Thomas, who is in charge of the work of the SEP in the health, amongst health workers. Our second speaker is Ebony, who will speak on the situation in Angonia, which is a small, remote town in the west of New South Wales, and Saman Gunadas, who is a representative of the SEP from our section in Sri Lanka. After those 3 speakers present their remarks, we will open up for questions and answers and discussion. And after that, we will make an appeal for our regular monthly fund and also discuss the campaign that the SEP is launched and has launched against the new electoral laws passed in Australia, which are entirely anti-democratic and designed to suppress any opposition to the policies of both the Liberal national governments and Labor, who have overwhelmingly supported it. So with those few remarks, I would like to introduce, as I said, our first speaker. Julia is a National Committee member of the SEP, and as I said, she leads the health work of the SEP. She has written for the World Socialist website in this area, and especially in the field of aged care. Julia works in health administration, and for that reason, she won't be on camera. But I would very warmly welcome Julia as our first speaker.
Thanks, Cheryl. And I'd also like to welcome everyone to this meeting today. It's been some 22 months since the emergence of COVID-19, and still there's no end in sight to the global pandemic, with surging case numbers, hospitalizations, and deaths. There have been over 233 million confirmed cases of COVID-19 worldwide, and at least 4.7 million people have died, although studies looking at excess deaths have estimated that the real death toll could be more than 3 times as high. Increasingly, there are reports of breakthrough infections, that is, infections among those fully vaccinated. The more the disease has spread, the better it has become at evading the immunity offered by vaccinations. For those who survive COVID-19, approximately 1/3, including children, will develop symptoms of long COVID, including persistent loss of smell, shortness of breath, and chronic fatigue, leading to cognitive and memory issues and difficulties with concentration. Contrary to the lies promoted by the ruling elite and the media that children are not as affected by the virus and don't spread it as easily, as of last week, over 5.7 million children in the US alone have tested positive for COVID since the onset of the pandemic. The number of pediatric cases exceeded 200,000 for the 5th consecutive week, and almost 20 children have died each week in that time. Though vaccinations are being touted as vital to reopening society, most children remain unvaccinated. The centre of the pandemic is again in the United States, where the official death toll has surpassed 700,000. In September, it officially became the deadliest outbreak of infectious disease in American history, eclipsing the 1918 Spanish flu pandemic that killed 675,000 Americans over 2 years. More than 100 years later, human society is objectively far better prepared to stop and eradicate COVID-19. highly effective vaccines against the virus were developed in just 10 months. Revolutions in communications and information make it possible to have detailed knowledge about the whereabouts and contacts of infected people, and the ability to treat patients with effective and safe therapeutics is readily available. Yet the virus continues to spread, maim, and kill at increasing rates. This was entirely foreseen, foreseeable, and preventable, and it's entirely the result of the deliberate policies of capitalist governments around the world. In August, the World Socialist website held an online public meeting featuring 3 scientists: Professor Michael Baker of the University of Otago in Wellington, New Zealand, Dr. Malgorzata Gasparovich of the University of Calgary in Canada, and Dr. Yanir Bayam from the New England Complex Systems Institute in the United States, all leading experts in their fields in pandemics and other infectious diseases. Taken together, their presentations are a staggering indictment of the policies adopted by most countries from the outset of the pandemic, and they make it clear that global eradication is the only scientifically grounded and effective strategy. To take just one example from this important meeting, but I'd encourage everyone who hasn't seen it to view it in full, and we can post a link in the chat. A presentation by Dr. Gasparovich showed that emergency coordinated action at the start of the pandemic could have successfully eliminated the virus in a relatively short period of time. And her data showed that even without vaccines, aggressive public health measures, that is lockdowns, travel restrictions, universal testing and contact tracing, and the isolation of infected individuals, could have brought new cases to 0 in just 37 days. If such measures had been implemented in early 2020, the global death toll would be measured in the thousands, not millions. Despite the warnings and advice of scientists and epidemiologists, these scientifically necessary actions were not taken, allowing the virus to mutate, with the Delta variant being up to 3 times as infectious as the original strain. The presentations made clear, however, that even now, emergency action can bring this terrible disease under control. With the assistance of vaccines, Dr. Gasparovich explained, aggressive public health measures could eradicate the virus in the space of 2 months, but vaccines alone are not sufficient. She said, the Delta variant is our wake-up call. We need everything we have in our toolbox to stop it, to slow it down. The recent example of China, with the public health measures adopted in the outbreak of Delta variant in June and July, which included mass vaccination, aggressive lockdowns, mass testing, and mass contact tracing, successfully contained the outbreak, demonstrating that the virus can and must be eliminated and eradicated. But these measures have to be implemented on a global scale. While the virus still exists anywhere, it has the potential to spread everywhere. The social force that's blocking a rational, scientific, and globally coordinated approach aimed at the eradication of the virus is the capitalist ruling elite. Capitalist governments around the world have rejected the socially necessary, scientifically grounded response to COVID-19, which is for its total eradication. They have effectively abandoned all measures to contain the pandemic, ending lockdowns and other safety restrictions, and removing any barriers to profit-making activities of big business, and they have normalized mass death in the name of living with the virus. And this is no less true in Australia. Amid the country's worst COVID outbreak since the pandemic began, Australian governments are stepping up a campaign to lift the already limited lockdown measures, force workers into unsafe workplaces, and herd teachers and students into classrooms that will function as petri dishes for the virus. Today, Victoria has recorded its highest ever daily COVID-19 infections, with 1,488 cases, taking the number of active infections across the state to a new record high of 11,591. And there have been 46 deaths since the beginning of this outbreak alone. In New South Wales, there are over 10,300 active cases, with, as Cheryl went through in her introductory remarks, over 1,000 of these admitted to hospital, 212 in intensive care, 108 requiring ventilation, and many more under the Hospital in the Home program. And there have been 331 COVID-19 deaths recorded in New South Wales in this current outbreak. The hospital systems of New South Wales and Victoria are already in crisis, with reports of patients dying in clogged emergency departments and ambulances spending hours ramped outside hospitals. In every state of Australia, hospitals are stretched beyond capacity, even without COVID, after decades of cuts by governments, both Liberal, National and Labor alike. The virus has been allowed to spread to rural and remote areas in New South Wales, where there are fewer health services, staff and resources for dealing with COVID patients, as well as to Indigenous communities where, more than 6 months into the national vaccine rollout, fewer than a third of Aboriginal people have been fully immunised, and they have an increased risk of complications from COVID-19. Despite this, state and federal governments are proceeding with the National Cabinet Plan for reopening the economy, which was adopted by the federal government and all the state and territory leaders, the majority of which are Labor premiers. Under this roadmap, lockdowns are to be terminated once adult vaccination rates reach 70%, with most other safety restrictions overturned at the 80% mark. And so these would really be 56% and 64% vaccinated respectively, as a real part of the population. Despite children being entirely unprotected, schools are set to reopen in both New South Wales and Victoria in October. The federal government will soon end disaster payment for workers who have lost their jobs or hours as a result of the pandemic, in an attempt to force workers back into unsafe workplaces. Governments admit that this program, which is based on corporate profit interests and not public health and science, will result in a major spike in infections and deaths. There's growing opposition in the working class in Australia and internationally to these criminal policies, including among health workers who are on the front line of the pandemic. In the UK, as Cheryl went through, British parent Lisa Diaz issued a video statement via Twitter calling for a nationwide school strike in the UK on October 1st, which was yesterday, our time, and encouraged parents to take an independent initiative to keep their children at home and safe from the virus. And this received widespread support from parents and educators internationally. In Sri Lanka, around 90,000 health employees from more than 1,000 hospitals walked out for 5 hours on Monday to oppose the government's decision to slash the pandemic-related monthly allowance. The growing opposition of the working class comes into conflict with all the institutions of the state, and above all, the trade unions, which have deliberately kept workers' struggles isolated. They have refused to mobilise their members to demand adequate public health measures, which would include mandatory vaccinations, and have instead waged a campaign alongside big business to keep non-essential industries open, putting workers and their families' lives at risk. The recent anti-vaccine rallies in Melbourne, which were attended by a small layer of construction workers, but were dominated by far-right and fascist layers, are of a piece with the response of the unions, as well as the mainstream media and the ruling elite. This has been the response of the unions not just in Australia, but around the world. In the US, the Service Employees International Union, which refused to fight the wave of infections and deaths in nursing homes last year, called a demonstration in July against mandatory vaccinations of healthcare workers. On Tuesday this week, the American Federation of Teachers, the AFT, the second largest teachers union in the US, announced that it will co-host a town hall meeting with the far-right parents group Open Schools USA, which will give a platform to proponents of pseudoscience who oppose COVID-19 vaccinations and advocate for the scrapping of mask mandates and all mitigation measures in schools. This dovetails with the AFT's role in implementing the reopening of schools throughout the US. They have undertaken an aggressive campaign to force children and teachers back into classrooms, which has resulted in the deaths of at least 200 educators since July 1st, some as young as 24 years old. There is no legitimacy to the anti-vaccine campaign, which rests upon irrationalism and conspiracy theorist fear-mongering, and this must be opposed by workers throughout the world. While the public health response to the spread of the coronavirus has shown the complete incapacity of the capitalist system to safeguard the lives and health of the population, the effort to develop a vaccine, which is where the drive for profit was focused, has borne fruit relatively quickly. In part, this is due to the unprecedented speed and energy that characterized the initial work of scientists to discover the genetic code of the novel virus, the necessary precondition for developing a vaccine using a biochemical process involving messenger RNA. The safeguarding of public health in a mass society depends on a whole host of regulations. And the extension of universal vaccination throughout the 20th century was a byproduct of advances in science and the rise of healthcare and living standards in the population, which was only won through major social struggles by the working class. As the World Socialist website has explained, mass vaccination is an elementary requirement of public health and the defense of the working class. Even the presentation of the issue as one of vaccine mandates is false to the core, since it treats the issue of vaccination as if it is some sort of infringement on personal liberty. In fact, no individual has the right to infect others and endanger their lives. Those who are campaigning against vaccination by claiming they are an intolerable violation of personal liberty are peddling anarchism and libertarianism, which has nothing in common with the interests of the working class. And it continues, we say in our statement, it is unavoidable that anyone who has access to a vaccine but refuses to get it cannot be allowed to work beside others. In such cases, the individual should be placed on furlough, which can be brought to an end as soon as they are vaccinated. This must be combined with a systematic public education campaign led by medical experts and healthcare workers to explain the benefits and insignificant risks of being protected against COVID-19. The working class understands the necessity of public health measures in response to the pandemic. Lockdowns and other restrictions have been overwhelmingly supported, even in the face of the criminally inadequate provision by federal and state governments of the necessary income, welfare, and health support measures. The working class is confronted, above all, with a political and social struggle against the capitalist profit system. The international working class must be organised, mobilised, and armed with a scientific understanding and a socialist program to put an end to the pandemic, eradicate the virus, and save lives. To advance this fight, workers must break from the unions, which have demonstrated their opposition to these tasks, and build independent rank and file committees throughout the world. And such committees are already, have been and are being formed and are increasingly advancing a strategy to eradicate COVID-19.
Thanks, Julia. I mean, all the issues that are raised in the remarks of our speakers will be opened up for any questions or clarification in the discussion period. But our second speaker, and I'm very pleased to be able to introduce Ebony. Ebony has asked to be introduced as a proud Budgie woman from Northwest New South Wales, Southwest Queensland. She will speak on the situation facing particularly the Indigenous population in Angonia, as I said, a small remote town near Burke, and her campaign and her family's campaign to assist them. A very warm welcome, Ebony.
Thank you, Cheryl, and thank you, Julia, for your presentation before. Before I get started, I'd just like to acknowledge that I'm sitting on Wanneroo country in the Hunter Valley, and I would like to pay my respects to the elders past, present, and those coming up behind. I'd also like to acknowledge the various Aboriginal lands everyone's coming from across Australia, and also to the countries that everyone is coming from internationally. So thank you and welcome. So Ingonia is a small town of about 167 people, according to the last census that was taken in 2016. And it's a majority of people living there are Aboriginal. They are Murrawari people and Budgie people. So Ingonia is 100 kilometres outside of Burke, New South Wales. It's very flat country, it's hard country. It's red sand, shrubs, and it's a community that still practice their cultural ways. So they still go out and hunt and bring it in and share amongst community. When a couple of months ago, me and my family went out there for my auntie's birthday party, and everyone was fighting fit and healthy and in good spirits. And I thought, oh, wow, you know, if this virus doesn't get out here, like, it would just be, you know, it would just be awesome. Like, yeah. And then towards the end of August, we got a distressing phone call from my uncle out at Ingonia, and he said that his sister, our auntie, had been flown to Dubbo Hospital. So Dubbo is 436 kilometres from Ingonia, because Burke does have a hospital, but it's not a fully functioning hospital. So if you need emergency care, you're taken into Dubbo. So very much off country, very much isolated. Family can't go with you, and especially during COVID, no one can go with you. So he rang up very distressed, because from that they went into a lockdown as soon as that happened. So they were unable to get fresh food, fresh meat, to be able to, you know, be in lockdown in that time. And it was very distressing, because a couple of days after that phone call, he'd called back and said that he and my auntie hadn't received their insulin and heart medication. So that was quite distressing. So I took it upon myself to make some phone calls into Burke Hospital and into the AMS and try to get something to them, because they hadn't had it for 3 to 4 days. So yeah, that was quite distressing. So the following Monday, it got sorted. They got their medication, but it took, you know, someone that's me and my family that are, you know, 1,000 kilometres away from the situation to advocate on behalf of community, which is what we do anyway. But for a township that's 100 kilometres away, Burke, services and services should have been in place there before this had even happened. So that was quite distressing. So I took it upon myself to do a messenger Facebook group with mob out there, family out there, and we were just chatting and yarning. And I thought, well, you know, I've heard about these GoFundMe pages, not that I've ever done one before, and I thought, you know, maybe that's the way to go to get, you know, these fellas some food out there. And I said to the group, would you be interested in this? And they said, yeah, we'd love that. We'd love that support. So together we put together a blurb for the GoFundMe page and put it out to the wider web. And to this day, we've just raised $10,478 from our wonderful donors out there, which we're very appreciative of. And so that's how the GoFundMe page got started. So from that last week in August, and from the time that we set up the GoFundMe page, I'd learnt that they'd had a local emergency management committee based in Burke and who was heading up the COVID situation out there, and for Ingonia as well. So with that local emergency management committee, there was police, New South Wales Health, Murrumbooka, which is an Aboriginal organisation, and Berkshire Council and Rural Fire Service all sit on that. And I was told that the only way we could get food out there was to do either ring up the IGA or the local SPAR supermarkets out there and set up accounts for the Ingonia households, or basically that was my only option. There was no other options. So it's quite difficult, because one of the organisations, Murrumbooka itself, was an organisation that's been set up. It's a Justice Reinvestment Project, and it was set up out in Burke back in 2012, I think, or some many moons ago. And they have not once since their inception provided a service to Ingonia, who only sits 100 kilometres outside their town. So my mob out in Ingonia were quite concerned in regards to this, because they felt that they were being told how to do, what to do, and how to do it from people that they had never had contact with. So I tried to explain this to Aboriginal Affairs, tried to get in contact with the resilience mob that's also caught up with the COVID situation out there. But as of last week, we did a petition for Ingonia, and they everyone signed it out there, and we sent it out to Marambooka and asking them to step out of Ingonia, that we didn't want their services, and also Rural Fire Service. So as far as I know, Marambooka has pulled out, so they are no longer delivering food hampers. So in these food hampers, it's a 12 by 12 box, so it's not very big. And within these food hampers, there's things like green tea and chai latte tea and tins of tuna, cream tuna. Not that my mob were ungrateful for what they got. They were fine with it, but it's not the food that they're used to. So I tried to liaise with Marambooka and say, you know, it's not what mob eat. Is there a chance you can have like a meeting with people that are distributing these food hampers, and maybe, you know, ask, could ingredients such as flour, so they're big Johnny cake eaters. I'm not sure if you know what Johnny cakes are, but they're big, bit like naan breads, but just made on flour and water. So big Johnny cake eaters and wild meat eaters. So we tried to liaise that way, but it was just wasn't working. But so mob wanted to do a petition, so we did that, and as of this week, they have pulled out of Ingonia. And the GoFundMe page that we have set up delivers. We've got a but the butcher in Burke has actually set up accounts for each household out there, so they have got meat that way, and that's where the money will be spent for meat. And because another organisation out there, Aboriginal organisation, is sorting out the pantry and food items stuff, so we're working with them, we're doing that. But yeah, that's about where it's up to, but it's been a hard slog the last couple of weeks, just advocating on behalf of family and mob out there, and you know, and yeah, so but within that, my auntie came back from Dubbo Hospital, and has fully recovered. But we had another auntie, my father's sister, she was in hospital as well at Dubbo. She's recovered as well, but has since returned home to Ingonia. But sorry. But a couple of days ago, she was asked to leave by police, because not sure why, but because that's her place of residence. But she was asked to leave, so she has left. So it's quite a distressing time out there at the moment in regards to how things are being, what's been said. And yeah, sorry, I didn't mean to get upset. That was, yeah, sorry about that. Yeah, that's about where it's up to. But with Marambooka, the all food had to be delivered through them. So a couple of weeks ago, mob wanted Hawkesbury Helping Hands. I'm not sure if you heard of them, but people in Australia might have heard of them. They're based in Sydney, and they were doing these great big beautiful hampers out to Wilkenya, Willamaringal, Gaduga, and mob actually caught on at Ingonia and went, oh, look at their hampers, they're just amazing, and really wanted them. So a cousin of mine got that up and running from Burke, but then you probably would have saw on the news, 5 kilometres outside of Ingonia, they were stopped by police and said that they needed to turn around and redistribute the food, that Ingonia community weren't allowed to have it. So they took it back to Burke, got in contact with Ingonian mob and tried to find out where they could take the food. So they took it to another cousin's place of mine at Burke, and a couple of cars the next day did trips that were negative to COVID, went into Burke to pick it up and bring the food back for the community. So there's been little things like that. Ingonia's, like I said, it's only little. It's only 167 people. So will Kenya, the devastation out there, being Ingonia is probably 10 times worse because the population's smaller. So yeah, so at the moment, we're just taking it day by day and just doing what we can for community, helping in any way we can. But really upsets me that it took a family that's 1,000 kilometres away to get things started or get things going when there's a town 100 kilometres away that should have already had services in place for such a small remote town. Yeah, so that's our story.
Thank you. I mean, it is so important to both report and discuss, these events. I mean, what you were and your family were doing is what governments should do. That's the role of governments. And the fact that you had to go through all the twists and turns and blocks that you outlined is an indictment of those governments. But again, these are questions that we can discuss more in depth in the question and answer. But I mean, I think, and I'm sure I join with everybody in thanking Ebony for that report. It was a really very important one. Our third and final speaker is Saman Gunadas. Saman speaks to us from Sri Lanka. He is a member of the SEP Political Committee in Sri Lanka and is the convener of the Health Workers Action Committee, which functions in the island state, and is fighting to politically lead and direct and educate the mass struggles which are developing in that incredibly important country, about which nobody ever hears about in Australia. There is virtually never a report on the fact that there is a working class in Sri Lanka, that it is a combative, militant working class that fights, that undertakes political struggles and industrial struggles. You would never know, other than the fact that tea grows there, anything about Sri Lanka, which is why I think it is also very important that Saman speaks to us today. So again, I'm very, very pleased and proud to introduce him. So I'll leave it to you, Saman.
Thank you, Cheryl, for that introduction. Hello, everyone. First of all, I would like to bring the greetings from Socialist Equality Party of Sri Lanka and also the Health Workers Action Committee to this SEP Health Workers Forum in Australia. So I begin with the present status in Sri Lanka. Cheryl has given an introduction with that. Yesterday there was a minimal lockdown and for several weeks, and yesterday country was totally open. Public transport, then the state workers and all are called for work. So they opened the country amidst 1,000 daily infections in the country and around 60 daily deaths in the country. So these are also underquoted figures, and with very limited tests. Tests have been cut by almost 1/3 from months ago, and the lot of deaths also reported in homes because of at the peak that there were very few, almost the hospitals were overwhelmed. Overall, total infections exceeded now almost 500,000. Deaths now exceeding 13,000. So I would mention that even though Sri Lanka is a small island, it has a population almost similar to Australia, to have an idea. So the government, following the Western governments, it says the only remedy for the pandemic is the vaccination, but still just above half of the population are vaccinated at present, and with that they have, as I said, they brought the testing into minimal. So this is how the policy of the profit before lives goes on, and then the basic motto is the live with the virus. So as far as the factories are concerned, there's no social distancing and no health rules per se. And so with that, so there are almost 6,000 to 8,000 health workers are infected. The more than dozen dead by now. This is just before the next upsurge. So that is the sentimental around the country. To give you a little bit of the flavor, yesterday one of the dailies was editorializing, this is interval in the hell. So that is a bit of the sentiment going on, even though this editorial is a kind of a reactionary one, but this topic gives some kind of an idea. So with that, I would like to go into the economic situation of the country. The pandemic has exacerbated the economic crisis, which was in a dire situation even before the pandemic, and the whole burden of the crisis is put onto the working class, while big business enjoy low-cost money from the central bank, and the windfall of profits due to slashed corporate taxes. The government never closed down the factories, the big factories. After the initial lockdown it had on 2020 March, they didn't lock down any factory after that. All so-called lockdowns were very minimal lockdowns. These are not really fit to the word lockdown. For an example, one factory in last October, we have seen that factory called Brandix, which is the most one of the most most widespread conglomerate supplying to places like Victoria's Secret and all. This factory, out of 1,400 workers, 1,000 got infected. So this was the order of the day of these factory infections. So with all this going on of the profiteering, the rich and the big businesses, they reap the benefits. For an example, last quarter, that is from April to June in this country, for the businesses, just 3 months, the 9 companies who are some of the companies, that's 9 companies listed in the both in Colombo, they reaped 364 billion rupees, that is close to $2 billion US. So for you to get an idea what is happening. So no economic crisis for the wealthy. But the government is strangulating the working class, the farmers, the poor. That is the capitalist strategy, putting whole economic burden onto them, then preparing military, the draconian laws, whole state apparatus they are preparing against the working class and the downtrodden and the poor. So the President Gotabaya Rajapaksa came to power based on the Sinhala Buddhist racist forces. He began militarizing the country to crush the working class. He has placed generals, military generals in government positions, like the secretaries of the ministries, as well as the I mean, in the main government organizations like corporations, say like customs, the ports, and the wherever. So this is how he has been militarizing the country for last almost 2 years. And then not only that, he has brought the Essential Services Act in this May. According to this act, the strikes can be banned, and whoever who refused to work can be put down to jail up to 5 years. And then come August, he brought the emergency powers under the pretext of finding hoard food. But with these emergency powers, he gets absolute powers, like he can make the laws or break the laws. Even he can ban organizations like political parties, and also can use the military at his will. So these are the powers which comes under emergency. And to mind you, in this island, this country, the ruling elite has used this emergency powers during last period for bloodbaths, like the communal war against the Tamils, against the Tamil community, north and east. This war went up to 3 decades, and there were around 100,000 people dead. And also, in end of 1980s, they used this emergency powers to kill the rural youth when there was uprising in rural areas of the country. And at least the available statistics, around 60,000 youth were killed by the forces. So all these were done with these emergency powers. So these brutal emergency powers now in force against the working class. So that is, with that backdrop, I would like to turn to the health workers, the situation faced by the health workers. So the health workers, as Julia said in her presentation, the 90,000 health workers struck work for 5 hours last Monday, 27th, around the country, that is from north to south and the east to west. Around 1,000 hospitals are in the country. So all these 1,000 hospitals, I mean, the strike was spread onto all these around 1,000 hospitals, and this strike came amidst the strike of the teachers, which is going on for almost 3 months now, to be precise, around a little more than 80 days. So this came amidst that strike, and the demands of the health workers was the pandemic allowance. That is the main demand. This allowance was stopped by the government. So they demanded that the allowance, and also the protection from the COVID-19 to have effective and standard personal protective equipment and things like that. So actually, this strike is latest of the numerous struggles during the pandemic, as workers who take the brunt of the devastation from the pandemic. For instance, the last week, the Tuesday, that is, I think, on 22nd, yes, the 30,000 health workers demonstrated in front of the hospitals. So so with this, you can understand basically the health workers are on struggle against this brunt of the devastation of the COVID-19, because they feel it, and they are on the front line. So with that, I would like to go into a little bit to the trade union role. Basically, workers were disgusted with the sectarian struggles and piecemeal agitations with these trade unions, so that they pushed these trade unions for collective struggles. So that is what we are now witnessing. But the trade unions had to collectively hold the strikes and actions. But in order to control the workers' anger, as they fear, as the trade unions fear, this anger could explode into spontaneous struggles beyond their control. So that is why they wanted to go for this kind of collective actions very unwillingly. And the issue is that the workers, they realize the strength when fight collectively, and they push the union bureaucracies for them to call collectively. But then these trade unions, they are making sure that nothing goes beyond their control. So that is what is happening right now. And the trade unions, they try to divide workers as much as possible. The workers' unity is poisonous to the bureaucracy. They use all whatever possible to divide the workers. Maybe the grades, maybe the sectors, maybe within the grades, intergrades. All these issues they use in order to divide the workers. And mind you, the Emergency Powers and the Essential Services Acts, which I explained, those were covered up by the trade union leaders, because they know that if they brought forward this in front of the working class, it warrants collective struggle. So they just cover up these things, and they just go on like that. So with that, I would like to come into the activities of the Health Workers Action Committee in Sri Lanka, which was formed by the Socialist Equality Party. Our latest statement during these struggles was the topic was the health workers. Let us take the struggle into our hand. We brought the argument in this, only the determination and the heroic struggle are not enough. There's a need to have scientific, above all, a winning program. So just the sake of struggle is not enough. Just the determination is not enough. So for instance, the trade unions, when they accept the government explanations of what they call the no money syndrome. There's no money for anything. The country is in economic crisis, so that you should not ask anything. For instance, if you take the trade union leaders of the teachers, I said that they were in the strike for almost 3 months. So they first went for a discussion with the government, and then first instance they accepted. Yes, we don't want allowance because we don't want the increase right now because the government is in trouble, because economically government is in trouble. So you just give us a promise. So that is the mentality, or that is the way that they try to bring the mentality to the workers. So we totally oppose that. As I said, there's no economic crisis for the wealthy. There's no economic crisis for the big business. There's no economic crisis for the big factory owners. But there's economic crisis for the working class. There's economic crisis for poor. There's economic crisis for the farmers. So this is how they operate. So what we say is, this is Mr. Capitalist, this is your crisis. This is not ours. So we fight for our lives, and we want to have a decent life, and that is it. There's nothing beyond that. We don't accept any crisis as such, because we know we are the creators of the wealth, and we should be the owners of that wealth. So that argument has to be there. And the other thing is, the unity is the strength. Against repression, against this repression, and against the emergency and the essential service laws, the integration is needed. The integration of the working class is very much needed. So that is the only way the working class can face this kind of brutal capitalist laws, which is brought forward to control the working class and they intimidate the working class, as well as to brutalize the working class. So unity is the strength, and that is the exact thing, exact phenomena these trade union bureaucracy is attacking. So then the importance of decent pay and equality. So with that, we bring the socialism onto the table, to the discussion. So it is very important to have the socialist principles in order to have a decent pay and the equality among the grades or the whatever the classes of the the class divisions within the working environment. So based on these things that we work inside the health workers to organize health workers. So what is the structure? As comrades already said, the speakers already said, what we call here action committees or the rank and file committees. Workers need independent working class program and independent body like action committees. So rank and file committees to counter this onslaught of capitalist onslaught effectively. So we warn the workers and prepare them to unite against militarization and the draconian emergency and essential laws. So at the moment, we have 3 hospital-based action committees. And of course, we need to expand. We want to strengthen these committees and to have a network with other action committees in Sri Lanka and internationally. We had very recently, we had some initial meetings in between teachers, students, parents, safety committees in Sri Lanka and the health action committees. So it was very revealing meetings. Those are the discussion and things like that. So we look forward for uniting internationally. I think as Cheryl has mentioned in the inception, yesterday's school strike called by the Lisa Diaz, it has shown the viability of uniting of workers internationally. It is not a distant goal or something like that. It is happening at the moment. It can take place, and it is very much a practical issue. So that it is very, very inspiring, which happened and which took place yesterday. So with that, I would like to invite the health workers participating in this forum to take initiative in your workplaces in Australia and be a part of this revolutionary program, which is the path to eradicate the pandemic and put the health and lives before profit and not other way around. Thank you so much.
Thank you very much, Saman. That was very important. Thank you. Now, what we want to do now is open up for any questions, any discussion, any comments. As I said, if there are any, please place them in the chat, and we will certainly endeavour to answer them. If you want further information about any of the reports which have been presented here, that is also, perfectly fine to ask. All right. Well, look, while you're thinking of your questions or any issues that you want to raise, one of the questions that has emerged and certainly is now receiving a lot of coverage, a lot of promotion in the anti-lockdown, anti-vaccination protests, which certainly took place last week or the week before last in Melbourne. The same have occurred in Sydney. There is, and behind a lot of concerns which have been raised, is about the development of the vaccines, how the vaccines themselves have been developed, how they're able to develop them at a speed which hasn't normally been associated with the development of vaccines. And I think there's been a great deal of misinformation, a great deal of confusion created by both the media, by governments, and in particular by extreme right-wing organisations. And for that reason, we have invited a very authoritative scientist who has actually worked and works in the respiratory area of health and medicine, to deliver just a brief outline of how the vaccinations in the 21st century, which, as Julia said, is unparalleled in human history in regards to communication, collaboration, international collaboration, the development of knowledge, technical, medical, scientific knowledge is developed at a pace which was previously impossible. And so I would like to call on Associate Professor John Brannan, who is a respiratory scientist and researcher with a background in drug development at the University of Newcastle, who has agreed to address the meeting today to discuss these concerns, which have been raised, and in many cases are raised out of sheer confusion and lack of knowledge. But he will speak on the development of the COVID vaccines in particular. And so again, if there's any questions that arise out of Professor Brannan's introductory remarks, then please feel free to ask them. But if we can get the professor on.
Thank you. Can you hear me?
Yes.
Sure. Yeah. Look, thank you. Look, it's been great to be a part of this forum. So I want to thank for the invitation to speak and to participate. I mean, I guess I found this rather fascinating. My work in drug development and designing studies into understanding the mechanism of established drugs, because sometimes we don't fully understand the role of drugs, even though they do have a beneficial effect, really has provoked my interest in this vaccine development process that we've just witnessed and we are witnessing. So the development of vaccines for COVID-19 have produced vaccines of really significant efficacy and safety in a short time span. And with this increasing knowledge that we're living through at the moment, that we've seen in the last 12 months, it's clear that these scientific discoveries are going to improve vaccines in the future. Vaccine development during COVID-19 has benefited, and it must be remembered that this is years of prior research and knowledge has gone into the current work that has taken over many, many years. And as a result of that experience, the development for vaccine and planning for clinical trials have taken place in a manner that's unprecedented and quick. And I'll try to explain some of these. So vaccine development has been, as I said, rapid, really rapid. And in fact, nearly less than 12 months after the identification of the virus, which one should be reminded, the genetic character of the virus was revealed in 1 week and shared throughout the world. I mean, this was unprecedented. In the past, this has taken many months to years to get to the same information. So years of research in other viruses, in particular HIV and SARS, provided significant experience to virologists and scientists to develop these new vaccines. And so the similarity of COVID-19 with the SARS virus and that outbreak that occurred in the mid-2000s was a significant learning experience that made this process a lot quicker. So there's already established international collaboration of scientists who share information regularly on virus and vaccine development. And these collaborations are wide and varied, but one that is quite well publicised prior to COVID is the consortium that's operated by the World Health Organization to monitor the standard flu viruses and to modify vaccines on an annual basis. So there's also been these established platforms and protocols for the development of vaccines that are very well known, and they've been tried and tested, and these established platforms have contributed to the speed of development. However, it's important to understand that so many people have been infected with this virus that there was a very large patient base. So the clinical endpoints that were needed were obtained a lot quicker, and that contributed to the rapid development. But and based on prior knowledge, some of the what essentially happens is that the vaccine gets discovered and then it goes into development, following an understanding that this vaccine is efficacious, but in this particular example, in this particular case, time couldn't be afforded on that front. So the manufactural preparations took place alongside the development, with some confidence that there would be some efficacy, but that also is considered to have taken at least 2 to 3 years off the timeline of development in terms of the manufacturing process. Further, it's important to appreciate in the last 12 months that again, these experiences, these developments are going to lead to more significant developments in the future, and I guess which is vitally important considering that this virus mutates. Look, millions of people have now been vaccinated, and while there have been side effects with some of these vaccines, there've been a very small number of patients. And not only that, ways to deal with these side effects have been improved significantly since these side effects were first identified. And when it comes to specifically the newer mRNA vaccines, there's really one thing to take home here, in that this particular vaccine has now been given to hundreds of millions of people, and there's not been a single death reported, and that is unheard of almost in relation to other pharmaceutical drugs. That demonstrates a significant safety profile. And just on that point, that is what you call a phase 4 of drug development. So phase 1 to 3 is, of course, in the laboratory and in the clinic. Phase 4 is the monitoring in the community, and that is mandatory, and it's mandated by law, by the regulatory authorities that govern the safety and efficacy of drugs around the world. And so that aspect is an ongoing, if you like, research platform that gathers important information that contributes again to further developments. Vaccine, look, I think one of the things, just to finish up on that, I think is quite important, that vaccine research up until COVID-19 actually had been slowed. So due to the decisions of many major pharmaceutical companies, they decided to disinvest from vaccine development because vaccines were not considered as profitable. Now, in the past, governments had publicly funded vaccine development programs, but of course, due to various cost-cutting measures over the years, these now no longer exist. And this should be considered on the understanding that the scientific community has been warning about new pandemics for many years before COVID. So the risk has always been there. And there's been much discussion in the scientific community by independent scientists in the medical literature in relation to their frustration of the pharmaceutical industry, who have the technology and the ability to do so, the frustration in their lack of interest in vaccine development. And this, to some extent, has hampered the process of developing a suitable vaccine. Now, just on that point, there is an interesting story that I became aware of not so long ago about a group in Adelaide who received in the mid-2000s a significant amount of funding to develop a SARS vaccine. The SARS virus disappeared fairly rapidly, and it wasn't seen then to be a major health problem. And so this group of investigators had their funding pulled. And this story is rather fascinating. And I think it's an interesting example of again, poor planning, in so much as if, and these researchers made it very clear that if they were able to get that funding, they would have had a vaccine candidate for COVID-19 that would have been well and truly approved and had been evaluated. And this would have had a significant impact on the ability to have a vaccine at the very beginning of the pandemic. So look, I think in conclusion, the eradication of the COVID-19 vaccine, COVID-19 pandemic is essential, and vaccines just make up just one part of a public health approach to combat this pandemic. And it's now clear from countries such as Israel and Singapore that there are very high vaccination rates. there is increased illness and hospitalisation, while mortality may be decreased. Thus a multiple approaches required to address this through various public health measures, including effective lockdowns and contact tracing. But look, that's a very brief overview, and I'd be very open to receiving any questions if they arise. Thank you.
Thanks very much, John. That was very helpful. We have got a couple of questions. One is to Ebony, and Margaret has asked, you said that the COVID situation in Angonia is worse even than in Wilcannia. How have governments, state and federal, allowed this to happen?
Hi, thanks for the question, Margaret. I think the lack of the rollout of the vaccines has been a huge issue. I know that the Aboriginal medical services out in the Western local health districts and Far West local health districts had been crying out for vaccines to come into their departments, so they were able to distribute to Aboriginal people. But I think it was a big lack of getting the vaccines and rolling them out. I mean, we were meant to be one of the first people to get the vaccines, and now that this has happened, it just makes you wonder, well, why weren't these vaccines already, in the AMSs, at the GPs, out in these areas across the state, across Australia, for Aboriginal people to be able to get. So yeah, I think that was a big letdown from state government and federal government.
Thanks. Yeah, no, I think that's an entirely correct assessment. And in fact, I think as John Brannan, Professor John Brannan just outlined, it wasn't as if the pandemics per se had not been predicted and warned about. And it was also not as if the governments and health authorities weren't told that and did not know that the necessity to ensure that Aboriginal communities were vaccinated first and fast and completely 100%, and it was not done. And these actions cannot be put down to just incompetence and mistakes. These are conscious decisions, just as they were conscious decisions not to vaccinate aged care workers, not to ensure that that broad sections of teachers were vaccinated. I mean, these are ongoing examples of the policies, the real policies, notwithstanding what is put forward, but the real policies of these governments. We have another question from Yahaya, which I hope I'm pronouncing your name right. This is to John. Do you believe that natural immunity supported by strict healthy diet, using natural herbs and natural remedy, also regular exercise, can fight the COVID-19 virus without the vaccine? So that's a good question. Can I ask John to come back on?
Yeah, that's an excellent question. I mean, it's very clear when this outbreak started that it was impacting different groups of different age groups and different groups of patients with different risk factors. So cardiovascular disease, obesity, diabetes, for example. We know this from the ordinary flu vaccine, a flu virus every year, that the older populations are very susceptible, and there are people that die from the flu virus. Usually once you're above 80 years of age, that risk goes up fairly dramatically. It's quite unusual to see deaths in younger age groups. With this virus, it's a very different story. Its mechanism is still poorly understood, but in those that are susceptible, it's having an effect on a part of the body that's affecting volume regulation, particularly in the lung. And once this process takes place, it is very difficult to reverse. And in fact, this is what leads patients, of course, into intensive care. And of course, they're dying from these things. So I guess to answer your question, in some respects, these patients are at high risk because of pre-existing poor health problems. And these might have been prevented with, diet and regular exercise, because we know these things are important for good health. But, these processes are already in place. They cannot be reversed. And that vaccination is essential. And I guess we can see that because now what we're seeing, even if you look at the breakdown of infections in New South Wales over the last week, you'll see that the prevalence of vaccination is lower in those older age groups who have been vaccinated. And the higher levels, of course, are in the youth and children who have not been vaccinated. So this is viral infections, unfortunately, sometimes are going to impact people who are highly susceptible. And unfortunately, alternative methods and prevention is not effective, particularly when the virus is here with us. So we do need additional measures, and vaccines, of course, have been around for many years. In fact, first evidence of the use of vaccinations was 1,000 years ago in China. But really, the smallpox vaccinations and their discoveries in the late 1700s and 1800s, of course, demonstrated back then that something else was required. Some intervention was required to promote the body's immune system to create promote its own defences. And of course, this is fundamentally what a vaccine does.
Thanks, John. Don't go away, because lucky you're here, because we've got more questions for you. We have questions from Margaret Richardson, another Margaret, and these are to John as well. But I know that there's others in the audience who could also assist with the answering of some of these questions. Thank you. This is to John. What about the long-term effects of the vaccine, which as yet are not known? And the other question is, in Israel, it is now considered that 3 vaccines have to be administered to be considered fully vaccinated, though vaccinated people continue to die. Israel has focused on a vaccine rollout primarily as a COVID virus intervention. Uttar Pradesh in India has well over 200 million people. Home medical kits have been provided for those that test positive. The kits contain vitamin D, vitamin C, ivermectin, zinc, amongst other products. They have had a 90% success rate for home treatment. The success story of India has been highlighted to the WHO. India has a low level of vaccine take-up. Why aren't immunologists paying attention to the success of India? So, John, I'll ask you to answer that. And as I said, I know there's others in the audience who can also assist.
Look, to answer the first question, I mean, in terms of the long-term effects, and it's of course a vitally important question to raise, and of course it's an important for even regulatory authorities to ask such questions, which again, as I highlighted in my contribution, is the purpose of this phase 4 analysis, where there's constant data gathering on these vaccines now, and any drugs. But what's effectively happening is the vaccine is actually teaching your established immune response to recognise this virus when you come into contact with it. Now, the virus itself, the vaccine itself, doesn't necessarily stay in the body for a long period of time. There's, of course, a sort of a washout effect, but what it's left behind is a record that the fundamental immune cells, the T cells in the body, are able to recognise and therefore create molecules that effectively store that memory, if you like, in the immune response, such that when the virus does come by, it is a natural response that's being mounted. So So vaccines are effectively a way of tricking the immune system to learn what a foreign body is. And this is one of the reasons we have an immune system. I mean, just to remind you that autoimmunity is a disease whereby, the immune system mounts a response against itself, and that is a disease process that is extremely complicated. And there, of course, there's concerns about all these things, but one of the important aspects is to look at the history of vaccinations, and the historically vaccinations have been remarkably safe. And as I said, there have been some recent side effects that were, of course, seen with the AstraZeneca vaccine, but it was these were extremely low. And what I've since understood is that the prevalence of mortality to that vaccine now has been reduced dramatically, because there's now an effective understanding of treating that side effect. And that's partly the reason why we're not seeing such mortality to that vaccine, even though, as I said, it was in low levels. In relation to the question from India, I'm not fully familiar with that literature and that story. I mean, I think there is some. If you get on the if you look in the medical literature database, there is a lot of evidence in relation to, for example, vitamin D promoting immune responsiveness. There's numerous examples of vitamin D levels, if they're low, increasing your risk of infection. And it's an area that has been researched a lot, and that these interventions may well have an effect. To really evaluate that, though, they really should be done in a proper, scientific manner. But what you report in relation to these effects in India is rather interesting, and I will endeavour to read more. I mean, if anyone else can make a contribution on that, I'm very happy to hear it.
I know there is a Gary who is a junior doctor in a major hospital in Queensland, has indicated that he would like to speak. And I think at this point it would be helpful. I know he wanted to speak on the question of vaccine mandates, which have itself also, alongside the question of raising the safety and efficacy of the vaccine, the issue of vaccine mandates has also been brought forward. So possibly, Gary could assist in answering these two questions of Margaret's. And then we have two others for Ebony. So Ebony, don't go away. But I'll just one point, however, just on the question of ivermectin. There is now increasing reports in the United States of people suffering poisoning, including death, from the use of ivermectin. Which needs to be considered with a great deal of thought. I mean, this is not a drug which has been developed for the use against viruses. Its use for non organised and undertaken measures can have a really profound impact. And while as yet the numbers are relatively low, in fact, the poisonings from ivermectin have doubled between this year and last year, and including deaths. So, but with those points, I'll ask Gary to be unmuted.
Thank you, Cheryl. Look, in order to answer the question, I mean, I'd like just to echo the comments that were just made. Ivermectin is not a drug that's been proven to have any effect really on COVID, and has been proven to have many side effects that could be very harmful to people. It's a drug that's prescribed for certain parasitical illnesses, it does have a benefit in use there. There was a study that was performed last year that indicated that it might be possible to that ivermectin had some effect on COVID. But that study that was published by Australian researchers basically showed that the dose that would be required is essentially impossible to achieve in humans, and would prove extremely toxic to them, as it has been demonstrated as such. And a similar point can be made about another drug that's sort of heavily promoted, which is hydroxychloroquine, which is a drug that's used for patients with autoimmune diseases, things like rheumatoid arthritis. These, again, it's not a drug that was ever intended for this sort of purpose, and the doses in which it's being given, again, are very likely to cause harm. Not to mention, divert vital resources and drugs from those patients who actually need them. There is a shortage in the world now of hydroxychloroquine for those patients who need it. There is a shortage to a lesser extent of ivermectin for those who need it. And it's partly because of its entirely illegitimate promotion. One aspect, and Professor Brannan has spoken about this, but I think it's important to reiterate, scientific research is a methodical, rigorous, and difficult process. There are many times in history in which a drug or a certain treatment has seemed to be quite promising, but on further scrutiny and review has been demonstrated as being highly ineffective or even harmful. And it requires peer review, it requires regular update of information, or ability to reproduce results that are found in a study. Just because one study demonstrates that something might have a beneficial effect doesn't mean that it will, if it's subjected to further scrutiny or review. And this is an aspect that has been, in many cases, I think, deliberately undermined in the case of the pandemic. The promotion of ivermectin, hydroxychloroquine, other sort of bogus cures does have a real political purpose, and it serves as a means, to justify the inaction of governments in emphasizing proper scientific measures that would actually prevent deaths. The fact of the matter is, proper lockdowns, as Julia outlined, would have stopped COVID in its tracks. In the beginning, it would have taken 37 days, was the estimate, to eliminate COVID back in March 2020. Even now, with the Delta variant being almost 1,000 times more virulent than the original COVID variant, it would still be possible within 2 months with a proper internationally coordinated system of lockdowns and quarantines. That's without vaccines. But the fact is, the governments around the world did not pursue that, and they did not pursue that because they viewed any lockdowns and quarantine measures as an intolerable diversion of profit, and the ability to force workers back in the workplace where they could be exploited. And in order to, in a sense, cover up for that, there's been this promotion of anti-scientific and even anti-vaccination ideas. The idea being that if the population can be sort of encouraged to accept, there isn't sort of a means to eradicate COVID, or we can learn to live with it, or these medications might work. It will soften people up in a sense, and allow them to and turn them away from measures that would actually work, but would essentially be harmful in a sense to the bottom line, the profit bottom line. The example of the point about India that's being made. I agree with Professor Brand that those kits and those policies need to be investigated more closely. But I do want to make the general point. India went through an extremely horrific wave of COVID back in April, March, June. It still has fairly high case numbers, and of course, because of the completely inadequate healthcare system in that country, it's actually very difficult to know what the true case burden and rates of death and debility are. But what we saw in those months was a system that had completely broken down, and the reason was entirely because of the government that allowed a reopening of its society, that allowed people to put themselves in very dangerous situations. It allowed a number of festivals and religious events to go ahead that served as super spreaders. Again, regardless of what is the benefit, what is the point of these home kits? Well, it's the fact that they actually don't have the capacity to hold any large number of COVID patients, which is what was demonstrated earlier in this year. And I think people have to take into account, when we consider what's being promoted and how it's being promoted, there is as much a political dimension to it as there is to a scientific dimension. Genuine scientists, and to put it more directly, genuine scientists don't go around promoting miracle cures. They don't go around talking about how something is definitely going to work or something is definitely not going to work. They speak in probabilities. They speak in terms of evidence. They speak in terms of following things up. And I think everyone here needs to be aware of that. I think that's an important point to make about this. So I'll just make those points.
Gary, did you want to raise the question of vaccine mandates now, or did you want to leave that? I mean, we are actually starting to run out of time.
Yeah, I can speak briefly about it.
Okay.
That's all right. Look, I just want to echo, first of all, what everyone else has said, and I really do want to thank all the speakers. I think their contributions have been extremely important to this very vital meeting, and really shows the many dimensions that workers have to consider in the struggle against COVID. I do want to speak briefly on the necessity of mandatory vaccinations. So, as has been reiterated, vaccines are not enough to eliminate COVID and eradicate it, but they are a vital part of any global program to end the pandemic and save lives. And there are questions, including among healthcare workers, about the legitimacy of mandatory vaccination and whether these policies represent a violation of democratic rights. And I think the reason those misconceptions exist is really the product of misinformation and outright lies on the development and distribution of vaccines. First of all, mandatory vaccination has always been needed for mass vaccination. Vaccines are not cures, they are preventative measures. And vaccines are most effective when administered to as many people as possible, as quickly as possible, to minimize the ability of a disease to spread within a population, and protecting the very small proportion of people who cannot be vaccinated is genuine herd immunity. In our globally connected world, where people and goods travel widely, it has been understood for decades that vaccination programs must of nature be international and mandatory to be effective. Mandatory vaccines or vaccine mandates first began in the 19th century in Europe, where it was found that regions with mandates achieved a far lower death toll from smallpox epidemics. So, for example, in the years before England and Wales mandated smallpox vaccination in 1853, 10 times as many people died of the disease there as in Italy and Sweden, which already had mandates. Around the same time, a number of states in America introduced vaccine mandates and achieved as much as a 20-fold reduction in smallpox rates. Led by doctors and scientists in the Soviet Union and the US, an international program of mass vaccination, quarantine measures, and rigorous testing, tracing, and verification eliminated smallpox by 1980. This elimination has been estimated to have saved 200 million people between 1980 and today. And mass vaccination programs have also succeeded in at least partially eliminating and reducing the rates of dozens of other diseases, perhaps the most well-known are measles and polio. Around the world, they're commonly employed to protect children, healthcare workers, and their patients, and certain vulnerable populations. Thanks to them, the WHO estimates that at least 3 million deaths are prevented per year. Mass vaccination has never been without its opponents, with smallpox, polio, and measles being particularly heavily opposed in their time of introduction. The success of any program was never really due to the benevolence of capitalism, but the principled efforts of workers and dedicated scientists. Anti-vaccination programs in the last 200 years, anti-vaccination campaigns in the last 200 years have arisen by a variety of causes, but are always exacerbated by a ruling class that is reluctant or hostile to facilitating mass vaccination, which by their very nature must be free and easily accessible, and that therefore diverting resources from profiteering. In fact, the failure to eliminate diseases like measles and polio, for which vaccines have existed for decades, is because the governments in many countries, including the advanced capitalist countries, have cut funding to essential public services, including vaccination and effective quarantine facilities. 1.5 million people died of vaccine-preventable diseases in 2019. And measles and polio outbreaks have surged in the last decade, partly because of the wars and invasions by US and Western European imperialists in the Middle East and North Africa. We've discussed the safety of the COVID vaccines. Let me reiterate, they are very safe and very effective. Even with the Delta variant, which is able to partly evade immunity from what we can gather, they are able to reduce hospitalizations from severe COVID by up to 90%. And the rates of death in immunized persons are nearly 1,000 times lower. Like all medicines, vaccines do have their side effects, but as Professor Bannon has outlined, they're extremely rare. Only 9 people in Australia have died from vaccination, despite 19 million doses being administered till September. By contrast, 1,300 people have died in Australia of COVID, and the rates of its long-term physical and psychological impacts will likely be far higher. Workers have a responsibility to get vaccinated, therefore not only for their own safety, but the safety of their families, workplaces, and communities. This pandemic is only going to be eliminated by international cooperation amongst all workers who are prepared to understand the need for scientifically guided lockdowns, quarantine measures, and vaccination. It's not impossible, and the eradication of COVID is really the only rational, valid, scientifically valid, and moral course available to humanity. The alternative, which has been embraced by all capitalist governments, really means the deaths of tens of millions and the immiserating of the entire human race. The entire response of the ruling class to the pandemic has been shot through with deceit and criminality. The elite of every country view vaccination as a means to justify their policies of living with the virus. In other words, get people vaccinated as quickly as possible and we can open up, regardless of the consequences. And of course, the vaccines themselves have been subjected to various machinations between the imperialist countries to advance their geopolitical aims. On a global scale, the vast majority of humanity has limited access to vaccines. Barely 4% of Africa has been fully vaccinated. The rates in many parts of Asia are not much better. And the vast amounts of social inequality in most countries means that the wealthy and upper middle classes may have access to vaccination, but the poor often do not. And this divide has been seen in Australia as well between wealthy and working class areas, and access for rural and remote communities is even worse. And this is as virtually every state and territory in this country is rushing forward to end lockdowns and quarantines once a very arbitrary target of adult vaccination rates is reached, despite thousands of active cases. Under these conditions, anti-lockdown and anti-vaccination protests and beliefs serve the purpose of the ruling elite because it allows them to blame the unvaccinated for essentially allowing COVID to spread and allowing them to proceed with their policy of reopening and social murder, rather than being blamed themselves for failure to provide adequate vaccination programs. And that is the reason, this support of pushing workers back into work and continuing their exploitation. That is the reason why far-right forces, who you've seen have been involved in every lockdown and anti-vaccination protest, have been there. These are the inherent enemies of democratic rights and the lives of working people. They're not there for that reason. I'll conclude by saying that the policy of workers has to combine political intransigence and patient explanation, the development of a class-conscious labour movement through the organisation of rank-and-file safety committees in every workplace would enable workers, particularly those in healthcare, to become advocates in a political campaign to require vaccination and protect themselves from the daily danger of the pandemic. And I urge everyone to join this movement today. Thank you.
Thanks very much, Gary. Look, I think some of those contributions have actually been really very helpful. We do have a few questions which I'm anxious to get through. Now, there's one from Carolyn. We hear all the time that there is vaccine hesitancy in Aboriginal communities. Is this the case, and if so, why? And both of these questions are for Ebony, and Catherine's is basically, where was your auntie taken and why?
Okay. Hi, thanks, Carolyn. That's a good question. Basically, Aboriginal people have a big distrust in government, and that's due to the past policies and events that have taken place in history here in Australia. So I think a bit of the hesitancy is around that, is putting trust in government once again. And I think another big thing is that a lack of education around COVID, especially in our rural and remote communities. And also with that and the seriousness of COVID as well. I don't think that's coming across into communities out that way as well. So I think that plays a big part in that as well. Also, a way around that would have probably been to have community champions within those communities driving that education and talking about how serious COVID is, would have been a great opportunity for that as well. I think my auntie ended up going back to Dubbo, Catherine. Thanks for asking. She's now with her sons. I've been trying to get in contact with her since yesterday when I found out this had occurred, but haven't been able to get in contact with her as yet. So we're all a bit anxious about that. I'm not sure why. I'm yet to speak with police in regards to that. So yeah, I can't answer why.
Thanks a lot, Ebony. I mean, look, I think actually some of the points which you raise about the attitude of Aboriginal communities, I mean, are far more widespread than just in your communities.
Yeah,
I mean,
absolutely.
The mistrust of governments, the fact, I mean, even the fact of the entire misinformation campaign which took place around AstraZeneca alone had an impact of ensuring that people could not be certain about just what it was that was suitable for them or not. There was no education program for either Aboriginal communities or anything else. Yeah. But in that sense, it's more heightened, more, I think, sharp amongst Aboriginal communities, not least of which because a lot of your communities are so remote and isolated, and they have real underlying health issues. So I think some of the points that you raise in regards to that are absolutely correct and far more applicable. So there's one more question. Oh, there's actually two more questions. Oh, sorry. One is to Saman, which is, can you provide the information regarding the accuracy of the COVID statistics and the number of tests conducted in Sri Lanka? And I'm sure that relates to the points that Gary raised about India's notoriously unreliable and inaccurate reporting figures. Are the same? Does the same situation occur in Sri Lanka?
Of course, thank you for the question. I would like to compare a little bit with India very, very briefly, in the sense that the Indian situation, if you take the Indian situation, it is like there's a huge rural areas in India where there's absolutely no statistics and there's no any medical facilities as well. Almost where the 70% of the people are living. It's a vast land area. So that the Indian statistics is very much under quoted statistics. When it comes to Sri Lanka, it is not the case for just you can't compare exactly with India, but still there are a lot of ways that the government is manipulating the statistics. One is when it comes to the deaths, the deaths are reported, but still they define the deaths that because as here the doctors have mentioned, the underlying some kind of medical histories are there for this cause of death. So the government decides, so the government health ministry is deciding whether this caused by the COVID or else something else, because this is a very gray area. So they only decide that whether it's a COVID death or not. So I mean, because of this situation, we have seen there are a lot of aberrations in the statistics. Likewise, and that is when it comes to the deaths. Generally the deaths are registered, not like in India. India, you have I mean, so many deaths are not even registered, but here the deaths are registered. But this issue is there. So when it comes to the statistics of the COVID-19 infections, there's a huge issue here in the sense because of the less tests. So as I said, and as question also asked, that I can't exactly remember the amount, but it was almost they cut by 1/3 by now from August. So August, we have seen a huge upsurge of the COVID-19, and then now there's a reduction. But now the issue is since the tests have been reduced drastically, we exactly don't know that what is happening inside the society, and they for sure that it is not the real figure what we are getting at the moment because of the tests. So that because of the very less tests, according to Worldometer, it is like 200,000 for 1 million. But the ground situation is much lesser, and they do RAT as well. The PCR tests are much less. So this is the situation. As far as the statistics are concerned, the statistics are basically underquoted, and also when it comes to the home deaths. So we have seen in last few months, a lot of patients had to be home treated because the one thing is the hospitals are overwhelmed, so that the patients are also volunteered to be at home because they don't want to be harassed or the kind of in a very uncomfortable situations under the beds and things like that in the hospitals. And because of that, there are quite a few deaths occurred in homes. So these also a bit of a gray area when it comes to the statistics and the real cause of the deaths. So because the system is not working as it should be, so that is why the system itself is not accurate. But then with this situation, system is not working as it should be. So they all affected to the statistics. So it is only an indication, and it is definitely not. We can't depend on that. So that's what I would say to that question. Yes.
Thank you. Thanks very much. Now I'm actually starting to lose track of questions here. There's Julia. Julia wants to speak. So if Julia wants to answer the question of Debbie's.
Yeah, so the question was, there's a very puzzling phenomena in the US, at least, of a number of healthcare workers refusing to get vaccinated. How can those on the front lines of the COVID pandemic be suspicious of the vaccines? I think, a lot of those kind of, the similar points to what have already been raised are relevant here. I think, the points that Ebony made earlier about the need for, education. I mean, there hasn't been a mass education campaign of health workers who, as well as other sections of workers, and the public more broadly. I mean, health workers come, are sort of working in various different areas, not necessarily coming across information about vaccinations. And I know where I work, at least, there was initially some, quite a bit of confusion from other health workers around this, questions like the speed with which it was, the vaccines were able to be created, which, Gary and Professor Brennan have gone through. Questions around things like, being mandatory. So I think that there has been a bit of confusion around this. And so the question of educating, the other point about the points raised about AstraZeneca, not knowing which vaccine, should be taken, and the slow rollout of vaccines, the lack of access to them. I think that this has all sort of contributed to the suspicion, but that is changing, and I think there are certainly more health workers as well as others taking up vaccination. But these questions I think need to be explained, and the necessity of vaccines fought for. Even in schools, I know in the US there's and elsewhere, a sort of campaign against the sort of unscientific anti-science that's being pushed through first the ruling elite, and then in the education curriculum that these things aren't taught, so all of this as well as a deep mistrust in the policies of the ruling elite, who have from the outset of the pandemic told people that the policies of the line of Trump and others was that this is just like the flu, that it's not serious, basically nothing needs to change. Trump and others as well have peddled these kind of what they're ridiculous sort of ideas, and have promoted miracle cures, as Gary went through. And so, I think, all of these factors have to be considered, and then, the way to fight that is obviously through, through the education of workers, through bringing workers into contact with science. I think some of the meetings we've held have been critical in this, the meeting of scientists that we held, because when armed with science, as well as, a socialist perspective, an understanding that, this is the product of the profit system, then this sort of, arms the working class with this. And, on that basis, the eradication of the pandemic can take place. So I just wanted to make those points.
And I think Gary wanted to answer the question about health workers as well.
Actually, Julia answered most what I was going to say. A very excellent response. But I'll just reiterate. There certainly was a degree of suspicion amongst many workers, and the point was raised about US healthcare workers. Well, one has to remember, particularly, since the pandemic started, they've been really on the receiving end of all of it. Thousands of healthcare workers have gotten sick and died in the US, and they've been subjected to an endless barrage of lies by the government, the ruling elite, and I think having had their lives so casually disregarded and discarded, I think many healthcare workers, or at least a certain minority, did have a sense that they were being used as guinea pigs. Why should they subject themselves to what might end up being yet another government lie? But it should be pointed out. In the US, as of present, more than 90% of healthcare workers have been vaccinated or fully intend to be vaccinated. So we're not talking about a very large proportion. And in fact, all over the world, healthcare workers have really been on the forefront of getting themselves vaccinated, getting their communities vaccinated, and being involved. Of course, there is a minority, and as Julia raised, much of that is a political as much as it is an issue of education. But point to make to health workers and the point to make to everyone is, of course, governments lie and manipulate. Of course, corporations lie and manipulate. And there are no guarantees in anything that's any drug or policy or anything of the sort. Workers have to take charge of a society if they want to have those guarantees. I mean, how else are we going to make sure that correct scientific policies are followed and lives are preserved? Well, by establishing a society that is based on science and that prioritizes human life over profit. That's the only way. And really, that's there's a quote, in these times, a person's destiny is political, and I think that's very relevant here. I mean, COVID is a disease. It's a natural disease, yes, but the reason it's been so disastrous has been the policies of capitalist governments all over the world. And regards of whether it's in regards to vaccinations or lockdowns or any of the rest of it, the only way it's going to be defended is by the concerted action of workers in a class-conscious manner. So just reiterate that point. Thank you.
I think well said. Look, I am going to make an arbitrary decision here and end the discussion. We have a comment from Margaret where she says that it makes me angry that COVID could have been eradicated if a strict international lockdown had occurred right at the beginning. Much suffering could have been prevented. This fact needs to be publicised widely so that people are aware of the inadequacies of government, which I think is a very salient point. And Kerry also raised, which I'll summarise, that how, well, in that sense, how critical is historical analysis of the factors of social, economic, psychological and cultural issues which need to be addressed in a public eradication campaign. So how critical is an historical analysis so that we understand what were the specific drivers of infection while in lockdown? How many infections, for example, were related to the need to secure income? Now, both these questions and comments, I think, are really very important, because what it raises, what it goes to, is the question of information, the question of the truth, which is, to be frank, a revolutionary issue. The fact that Julian Assange sits in a British jail, rotting in a British jail because he provided information which the security intelligence agencies had, which governments had, but which became a crime because ordinary people were given it. Information about war crimes, about intelligence breaches against ordinary people, against surveillance against ordinary people. It is the access of ordinary working class people to have information which is so feared by governments, by unions, by the ruling class as a whole. And it's why we publish the World Socialist website 6 days a week, why we provide an analysis, information, access to knowledge which is not available to broad sections of the population and of people of the working class on an international scale, because it is only through knowledge, whether it's scientific, technological, social, political, that workers can make informed and correct historical decisions. And that's why we hold these meetings. It's why we encourage discussion and questions and a flow of information and ideas. Where else do ordinary people get to do that now? There is nowhere. You can't do it at universities. You can't do it in union meetings. I mean, the organisations which were purportedly built to develop the interests of the working class, such as the Labor Party, are mere shells of their previous existences, and they function wholly and solely for the interests of the ruling class. And of course, that is why, to go back to the question of the electoral laws that were passed only a little over a month ago, are such an issue that ordinary people need to know about and react to. These laws were passed without any reporting in the media, without any prior discussion, they were rammed through within 24 hours, and that was only possible because of the support of the Labor Party, because both the Liberal national parties and government and the Labor parties are so increasingly opposed by broad sections of the population and of the working class. In the 2019 election, Labor secured 33% of the vote. It was the lowest vote that they had recorded for 100 years. That vote was particularly lost in working class areas. The reason that the Liberals won, the reason that the Morrison government is in power, is because Labor only lost more votes than the Liberals did. Both the major parties lost votes. And they both know that were they to go to an election under conditions where alternative political organisations were both able and identifiable, able to present their program, their perspective, and because it was only the minor parties that actually increased their support since the 2019 election. And so you have a concerted, conscious, anti-democratic attempt to stifle, suppress, and block the working class from looking for alternatives, and particularly a socialist alternative. Part of these laws provide for the Australian Electoral Commission to strip political parties of their name. The way that they have done that is that they have deemed that if there are numbers of political parties, registered political parties, who have the same word in their name, then the first registered can deem, can deem that the others can't use the name. In fact, for us, we have to get written permission from Socialist Alliance in order that we can use a name that we have used for 50 years, Socialist. Is that accidental? No, it's not. It is entirely bound up with the knowledge that the media, the existing two-party system understands, the political elite understand. Socialism is now being looked towards. It is being embraced by broader sections of young people and of workers. And that is something which they are consciously attempting to ensure does not take place. We have begun a campaign to fight against this, to both insist on the repealing of these laws, but also to appeal to our supporters, our base, to join as electoral members, to join our party as an electoral member, to ensure that our organisation can stand in an election and use our name, to be identified, and to ask and campaign amongst your friends, your work colleagues, your families to also join. We have a form which we'll put in the link, but everybody should seriously consider taking up this and taking up the fight for a socialist perspective. We will have to bring our meeting to a conclusion. But before I do, I do appeal to everybody to donate to our monthly fund. We also have a window where people can donate to. If you are outside Australia, I'm sorry you can't. You need to donate to the World Socialist website, because it's illegal for Australian political parties to accept money from outside the country. But we would certainly ask you to think very seriously about donating as generously as you can. Every month we raise $25,000. We raise it from workers. We raise it from young people. We don't get it from corporations, from state apparatuses. We get it wholly and solely from the working class. And we have financed ourselves for almost 50 years in that way. And so we appeal to you. And while you're considering whether you can and how much you can contribute, I also just want to draw your attention to some books that we have on sale. So these are our statement of principles, the Socialist Equality Party statement of principles, which is a summation. This is a very dense and a very concise summation of the basic principles of the Socialist Equality Party. And it is the foundation for membership. Agreement with our statement of principles, creates the conditions where an application can be made to our party as both an electoral member, but also as a full member. And we would very warmly urge you to consider taking that step. It is certainly, we are leading into a period of immense political ferment, of struggle, of opposition by the working class to the murderous, homicidal policies of capitalist governments and the drive to war. And nothing is clearer of that drive than the new alliance, which was announced on September the 15th between the United States, the United Kingdom, and Australia. This is a drive to war against China. Make no mistake about it. And this is, again, a conscious policy to undertake the mechanisms whereby such a war can be enacted. And the electoral laws themselves, the change to those electoral laws also are bound up with this perspective, because war abroad means war against the working class at home, both in order to extract from workers the finances which are necessary to conduct such a war, and also an attack on the democratic rights of the working class, because you can't have freedom of opposition, freedom of speech, freedom of association under conditions in which the government is carrying out a war which will place the Australian population on the front lines of such a war, and of course threatens the very existence of mankind, because certainly the United States, Britain and China are all nuclear armed countries, but that is what is taking place. So our statement of principles is certainly a very accessible but an important document to read. The next one is the global pandemic, the class struggle and the tasks of the Socialist Equality Party, which is the document of our United States section, which was adopted in 2020 at their Congress. And this is an assessment up until that point of the development of the pandemic, the class struggle, and the issues which confront our party and of course the International Committee. Both those pamphlets are $5. And then we have From Whitlam to Rudd, the Industrial Relations and Trade Unions under Labor. And this was produced by then National Secretary Nick Beams as part of the development of an understanding of the transformation of Labor. This followed the unprecedented sacking and removal of Kevin Rudd as Prime Minister, overturning an election completely undemocratically without the knowledge of either the population or even of the Labor Party or even many of the members of Parliament of Labor. And of course, this was part and parcel of the pivot to Asia, which Obama announced in 2011 in Parliament in this country, which was the beginning of the turn towards war against China. I mean, it did not begin with Trump and it did not begin with Biden. It actually began with Obama. So those three pamphlets, which are all $5 each, they're very accessible. I would urge you to purchase. But in closing, again, I want to thank our speakers, Saman Gunadas, Ebony on her contribution in regards to Engonia, Julia Thomas, and the contributions of Professor John Brannan, and also of Gary, our doctor in Queensland. I think it's been a very informative, very interesting meeting, and one that we will certainly repeat. We will post this video on our site and on Facebook, so it's accessible for those who weren't able to get to it. But I thank you all for your attention, your participation, your questions, and urge you to join. Thank you very much.